The topics and opinions expressed on the following show are solely those of the hosts and their guests and not those of W4WN Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4WN Radio, its employees, or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4WN Radio.
Hello and welcome to Fearless Fabulous You. I am your host, Melanie Young. It's good to be back after a brief sojourn away on my well-earned vacation to Hawaii. It is the beginning of September. The weather is being cooperative in terms of hurricane season here in New Orleans, and it is just beautiful everywhere. I am so excited to have this guest on because we're going to talk about a very important topic. We're going to talk about caring for your skin as you grow older, but also risk reduction for skin cancer. Why is it important? Well, according to the Skin Cancer Foundation, skin cancer is the most common cancer in the United States of America. With global warming, I think it's going to get worse because people are just out in the sun more. 1 in 5 Americans will develop skin cancer by the age of 70. Think about that. 1 in 5. More than 2 people die of skin cancer in the United States every hour. And having, this is important, 5 or more sunburns doubles your risk for melanoma, the deadliest form of skin cancer. However, when detected early, the 5-year survival rate for melanoma is still 99%. So we don't want to get melanoma. We don't want to get any skin cancer, but we don't want to get melanoma, period. This touches home to me for many reasons, and I'll explain it before I introduce my guest, why it's so important. I grew up in a family where my mother was a habitual sunbather. She was blonde with amazing Mediterranean skin. So she would get the color of a tree. I swear to God, she would get, this amazing blonde hair like this, but just the color of a tree. She was like dark, unnaturally dark. And she thought that was beautiful because back in the 60s and 70s, tanning was like a big deal. My poor dad had different complexion and he just burned. I have his skin. And they would leave me out in the sun and just, on the beach with no protection. And I got terrible sunburns. Over the years, we didn't know in the deep South about skin cancer back then, but we knew tanning was cool. And I used to sit out with my girlfriends with the records and the aluminum foil getting tan and doing sun lamps and all the things that are really bad for your skin. Now I'm a lot older. My father had melanoma. It's not what he died of. He died of metastasized prostate cancer, but he had melanoma. My mother had undiagnosed melanoma because she refused to go to dermatologists to have her skin checked. But I live since I think the late 20s, definitely 30. I went cold turkey and get no sun. I wear sunscreen every single day. I wear hats out in Hawaii. I was swimming in a hat. I was snorkeling in a hat. I'm completely covered. I'm a big believer in protection because I don't want to follow in my parents' footsteps. So that's why it's very personal for me. As a result, first thing I did when I moved to New Orleans was I made sure I had a very good dermatologist who I see regularly for every spot, dot, mole, anything I question, itch, you name it, rash, I get them all. I go to my guest today, who is Dr. Leah Jacob. She is a dermatologist, born and raised in Louisiana. She was a clinical professor of dermatology at my alma mater, Tulane University, and she now works with Family Dermatology Specialists here in New Orleans. I think I've seen her 5 times this year already. And I'm really glad to see her today on Fearless Fabulous You. So welcome.
Hi, Melanie. Thanks for having me.
Well, I'm really glad you could spare the time because I know you're super busy. You heard me review the stats on skin cancer. The seasons are changing. We are going into fall. A lot of people think that they're safe now.
Wrong.
Let's talk about the year-round potential for skin cancer and how to protect yourself year-round.
Yes. And I think right now it's even more important because we're getting this little cool front. So it gives you a false sense of security that maybe the sun's not as strong right now, but it's still it's still there and still important to use protection.
So let's talk about protection because, one of the things that we're going to address in this discussion is the impact social media is having on how people are taking care of their skin. So there's a lot of hoo-ha and hype out there about what you should be putting on your skin. Let's break some common sense into it and also assure all of my viewers and listeners that you don't have to spend a lot of money, which I have in the past. What is the best skin protection that, and not just what you apply on your face, but what you wear as well?
The best sun protection is the one that you will use. So there are thousands of different products out there. I think the two ingredients you need to look for are titanium dioxide and zinc oxide. Those are physical blockers. They work the best and they work for the broadest spectrum of UV rays.
And a lot of people are concerned about the environment and chemicals on their skin. Let's address that. Are any of these risky for potential C words, cancer words, or long-term health issues, or the environment?
So environment, that there are a lot of studies kind of suggesting that some of our chemical sunscreens are contributing to coral bleaching. So oxybenzone in particular is an ingredient that has been shown to perhaps affect our ocean environment. Titanium oxide and zinc oxide, I think, are both safe in regards to that. I'm not concerned about carcinogenesis with these two ingredients.
Well, I was just in Hawaii, and there's signs everywhere about reef safe sunscreen.
Yes.
Because the reefs are a mess out there. There's just no color left. But you also want to have sunscreen. Amazingly, Dr. Jacob, I can't begin to tell you how many people were out there just tanning. So somebody's not getting the message, because I saw a lot of tanning, saw a lot of skin damage, and I'm like, whoa, like people still don't listen.
That's why we're still in business, I mean, people know. I think there's a lot more awareness in terms of the harms of UV rays. I think our younger generations are much more aware of that. Mm-hmm. Tanning bed use has decreased, but people still love to go out and sunbathe,
Yeah, I know. When I was younger, my mother set me out there to Kobe would clear up my acne. The doctors, she had me sit in front of a sunscreen to clear a sun lamp to clear up my acne. Can you imagine?
I can, in certain doses, when it's well controlled and in a very specific wavelength of light, we use UV light to treat a lot of different skin diseases. It's anti-inflammatory, but again, it's in a controlled setting where we're giving you the exact dose that we know that your skin needs. So I do believe that was helpful, but we're able to do it in a much more controlled manner.
So to that effect, again, what's important is see a dermatologist. Don't do anything that you read about on Dr. Google or TikTok.
Please.
Really. So I get pitched a lot on anti-aging, pro-youth, you name it, whatever you call it. I don't like anti-anything. I like pro-aging.
Okay.
Pro. And so let's talk about speaking of light therapy, red light therapy and blue light therapy and green light therapy and whatever, rainbow therapy.
Yes. So red light therapy in particular, I think, is getting a lot of attention now. I get text messages probably weekly from friends. Do I need to get this device? And honestly, until recently, I kind of was like, nah. But we're starting to do a little more research. And in fact, I have my most recent dermatology journal. This is the Journal of the American Academy of Dermatology for August. And one of the articles was actually a review of the effects of what's called photobiomodulation, which is the use of light to treat various skin disorders, whatever. And this is a panel of 21 experts in dermatology, all board certified, and they're actually making recommendations that yes, red light can be helpful for an anti or sort of pro-aging approach, also for androgenetic alopecia, which is pattern hair loss. So we are seeing some uses for red light therapy with the skin, and in particular to improve signs of aging. But the real nitty-gritty sort of studies are still being done. But I think
I
it's
was
definitely
given one to try and ended up doing a
uh,
show, and I still have it. I won't say the name of the brand, but I use it from time to time, and I don't, I don't go crazy, but I use it. And I haven't seen anything bad happen. If anything, I think my skin looks better now thanks to you. And really, I'm crazy about what I put in my body and
yeah.
on my body right now. There's just a lot of gimmicks out there. We'll get into those. I want to get into the really important stuff. Now, I sent you a question like secondhand smoke. Is there a risk of what we call secondhand sun rays? I'll give you an example. I'm in the window seat of my plane. Should I put the window down? What about driving in the car on a road trip? Because I remember my grandmother's arm was just modeled from being like this. Is there a risk of what I call window sun or certain types of lighting?
Yes, I think so. We have now, as technology advances, the windows and the glass used to make our car windshields is becoming more advanced and protecting more and more against UVA and UVB rays. So we're getting better at designing glass that filters those out. But one of my favorite examples, it's in one of our textbooks for dermatology, is a woman who worked in an office, and for 40 years, she sat in the same place. She did the same task every day. She said, I never go outside. I go straight to work and I go home after it's dark. They showed her face, and one half, this half, is all tons of sun damage, wrinkly, saggy. And this half of her face is not nearly as bad. Sitting next to the window for 40 years, photo aged her. So there definitely is some damage that you can be getting through windshields, glass, etc. And even overhead lights, which is the visible light. I think there's something to that, especially for things like melasma or people that have photosensitive skin disorders. I think that the overhead light can affect that. So
What
even
about
being
computers? Like I'm looking at you.
yeah, I mean the blue light from screens can certainly activate certain things in our skin and make photosensitive conditions worse. So yes, there are hidden light sources in our environments.
So we should just be wearing sunscreen every day. And then melasma, you mentioned it. Explain it for someone who may not know what it is.
Melasma it's basically hyperpigmentation. It's very common in females because there's a estrogen or hormonal component to it. But it's brown patches on the cheeks. You can get it on the upper lip. But it's those unwanted brown spots usually is consistent with melasma.
Isn't that common in pregnancy?
Very common. It's the second name for it is the mask of pregnancy. So the estrogen and progesterone, when those levels are high during a pregnancy, it can really make melasma flare up.
So is it reversible, or how is it treated, and is it reversible, or is it permanent?
It can be tough. It can be sort of resistant to treatment, but the way we treat it, number one, you have to wear sunscreen. You cannot get any sunlight on your skin. And then we use things like hydroquinone or chemicals or medicines that help to inhibit the melanocyte production of melanin, which is what contributes to pigment in our skin.
Are there other ways that melanin increases? I'll give you some examples. Are certain medications prone to making you have increased melanin and sun sensitivity, which I know the answer to? That's my first question.
Yeah, sun sensitivity. There are lots of medicines that make you more sensitive to the sun. I see it a lot with blood pressure medications. Hydrochlorothiazide is one that very much makes you sensitive to the sun. Antibiotics can make you very sensitive to the sun. There's one that we use to treat acne. It's called doxycycline, that can create a blistering, horrible sunburn if you take it and go out in the sun. So definitely medications can cause different rashes when combined with sun. And then what was the other part?
Melasma. Is there certain medications that can
make
melasma?
It worse? Yeah, I mean, I think the photosensitizing medicines can certainly make it worse.
It's really important, everybody, to read every line of the potential side effects, and discuss them, because I am on I have been on doxycycline. Actually, you prescribed it for my rosacea, which we're going to get into. And I've had it. Doxycycline is very common for other kinds of illnesses. Yeah. Infections. I have lots of doxycycline in my life, and you do have to be super, super careful. When I was younger, I was put on something that made me so incredibly blistering, sun sensitive. It was probably dangerous. And you don't ask, you got to ask, you got to know, and really always just be on the safe side and wear sunscreen. And we won't talk brands. You and I have a similar brand we like, but if one clogs your pores and you don't like the feel, or it leaves that filmy thing, keep going, right? I mean, right. What should you look for? You mentioned the ingredients, but what are some things that could trigger sensitivity that maybe you should look for when you read those ingredients?
I mean, I always encourage people to feel the sunscreen on the back of their hand and look at how it looks on your skin. If you're a different, we call it Fitzpatrick type, but if for people that have sort of a darker tone to their skin, they may not like the same product that you or I like, someone that's very fair with blue eyes. So I always encourage people to try it out and see how it feels and how it looks on your skin. I have patients that really like the tinted mineral physical sunscreens because it's almost like a little bit of a makeup almost. For people that are acne prone, they're going to want to stick with some that say non-comedogenic. So that's a buzzword that you can look for if you're acne, rosacea prone, or have sensitive skin. So it's really trying and feeling. And that's why I always say the best sunscreen is the one that you're going to use. So find one that feels good to you. And some people may need more moisturizing properties with their sunscreen as opposed to a young teenager who has super oily skin. So it's very individualized and just about finding one that feels good to you.
You really have to check. I tell you what, I use one brand more than other. I've tried different ones. And once you find one that you just like and you're going to wear every day, that's the one for you.
Yeah.
I sometimes put a little of my makeup base in it rather than rely on the colored tinter one, because I tend to look red already because I have rosacea. I just get redder looking, and it also gets on your baseball cap. So I tend to just kind of mix and match my own with my very, very light base if I want a hint of color. But, I'm becoming part of the Pamela Anderson less is more group these days.
Yeah.
So, I'm going to ask you about that. So when we were in Maui, David and I decided to do a couple of things to detox. And the first thing we did as a test, we didn't drink alcohol. And as you know, we're wine writers. We drink wine every night. We went cold turkey, only drank water. And that was interesting. David's red flushed face went away and he looked less puffy. I was still red. I don't know why I was still red. And I came back and I had lost a pound. We also drank a lot of water. We wore lots of sunscreen. We slept. We did everything right because we wanted to see what would happen to us physically and emotionally. Like I said, David looks better than ever. But we did that, and I went with no makeup. And I always just wear a little bit every day just to hide the things, the blotches. It was freeing. It was great. And I think they always say give your face a rest. Is there something like that? Like, should you give your face a rest and do a detox? Does it really work, or is it something you have to do permanently?
I don't know that I love the word detox because it's overused, but certainly avoiding alcohol. As a physician, I know that that's going to make your skin look better and more hydrated, and it's going to reduce the redness for a lot of people because we know that it triggers flushing and can flare rosacea. I love my wine too, and that's not really for me to do a detox. But I think that is important. And if it depends kind of on your daily habits. If you're someone that wears really, you're on TV and you wear a very heavy makeup, then it may be nice to take a break from that and kind of let your pores breathe. So chemical peel can be a nice sort of detox, or just get rid of some of those extra layers of skin cells that are dead to kind of give you a little bit of a glow or a little refreshed look. So, I think that's sort of the place that detoxes have for your
pores
skin.
really breathe.
No, good point. No, but they need oxygen,
Yeah.
and when they get clogged and they get stuck and filled in with your skin cells and oil and sebum, that's what contributes to acne formation.
I mean, I'm a big believer in going less when I have my days off, which seem to be a lot of days off like these days. So first, not working as much, but also water, hydration, oodles of it. And I don't smoke. Let's just talk about the many reasons, and including what smoking does to your skin.
Yeah. So nicotine constricts your blood vessels. So every time you inhale nicotine or chew it or whatever, you're reducing blood flow to your skin. Blood is what's going to have our nutrients, the oxidants that we need, or I should say antioxidants that we need to keep our skin looking healthy. Nicotine is just reducing that blood flow and essentially causing ischemia of your skin. And that includes vaping. Vaping is the worst thing that you can do.
And so many young people are doing it.
It's a big thing right now. And the other thing I see are these, they're called Zen. It's nicotine pouches that a lot of the younger folks are using. But the nicotine in any form is just really bad, and it's going to age you a lot quicker if you're vaping, smoking, etc.
So I wonder how that works with, the big thing now is THC drinks and products, and which are eating into the wine business. I don't know if there's enough research out there yet to see what the long-term effects of that are, but I would think that there's going to be long-term effects.
TBD. I have to think, if there's nicotine in the THC products, that's one thing, but pure marijuana or THC versus smoking a cigarette, I don't know that one is necessarily worse than the other.
Okay, here's an interesting one. So growing up, I was petrified of eating chocolate and fried food. Like, I still don't eat fried food. I was petrified of sugar, actually. Because my mother was a sugar addict. I was told chocolate was going to make my face break out. I was told if anything fatty and greasy was going to make my face break out. Let's talk about the diet aspect of this.
Okay, yeah. So chocolate is all you hear about that. And what our research has shown in dermatology is that it's actually the dairy and sugar content. It's not the cocoa. It's the milk and the sugar in it that can trigger acne flare-ups. When patients ask me what kind of diet do I need to follow, it's usually people that are prone to acne, rosacea breakouts. And I think the high glycemic index diet, or should I say a low glycemic index diet, would be the most important thing to follow, because we know that the bacteria feed off of all of the sugar molecules, and they just love that. So a low glycemic index diet is probably the most important thing. Her overall skin health, just eating real food, not eating processed food, eat things that are grown from the ground and don't eat too much of them.
It's interesting. I've traveled to Asia a couple times, and Asians have fine pores. We'll talk about Korean stuff. Beautiful pore. It's, bless, poreless people I love. And then I got to Singapore. And I've never seen such bad skin in my life. Bad skin, bad acne. And I could only think it's because there's more fast food in Singapore, or the diet, because it was so dramatically different.
Yes. Our diet in the West is terrible. I mean, it's just awful. It's very rare that people actually eat what seems like real food anymore. I mean, anything packaged is just pumped full of preservatives, and it's not good for us.
No, it's not. And I think one of the things when we were out in Hawaii, and I tend to eat, I hate the word clean, but I tend to eat unprocessed and food in its natural state more. And I could see that and feel it. We had more energy and slept better. I mean, you just will feel better and look better. I didn't lose any weight, but I looked better and felt better.
But you felt better, and you're not somebody that needs to lose weight. But
And Hawaii, let's talk about that. The whole Ozempic face situation. Are you dealing with that now in your?
Yeah. I mean, we're seeing it. for sure. It's with any rapid weight fluctuation, you're going to notice changes in your skin for sure.
Like, give us some examples.
Well, so people call it, Ozempic face, which is basically hollowing. You lose subcutaneous fat in the temples and in the cheeks, so people look very sunken in, and they don't like that. You can see with rapid weight loss some vitamin deficiencies. I really haven't seen that too much with the GLP-1 agonist, but the Ozempic face is the big one that people notice, and also hair loss. We're seeing a lot of that. And again, it's not just with these medications, it's just rapid weight loss, weight fluctuations can trigger a form of hair loss.
Wow. I was reading up on how to avoid this because the whole flappy skin syndrome is a big one. First of all, try to keep your weight in check, really.
Yeah.
Don't fluctuate.
Don't fluctuate, because when you stretch it out, it's like a balloon, and when it collapses back, it's stretched, and you've broken elastic fibers in your skin, so it's not going to be as taut as it once was.
Since COVID, whenever we were all indoors, sort of, and drinking, our lifestyle changed, and maybe even before that, you tell me, what have you seen different in terms of patients coming in? Are you seeing anything different, or is it the same old situations coming in? The condition.
That's a good question. I can't say that I've seen a whole lot change just in terms of what issues we see. COVID certainly changed the way we do medicine. Now there's a lot of telemedicine, teledermatology, so you can do virtual visits. That is more so what I've seen changed. I think I have seen patients that come in and they say, during COVID, I gained a lot of weight. But in terms of how it changed our skin and the health of our skin, I don't know that we're seeing that yet.
Well, I would think, and I think if anything, the fact it's too soon for a lot of things. I know it changed a lot of people mentally, and it really impacted the elderly. I think if anything, the elderly were hurt the most because they weren't. My mother is an example. So she had a thing growing on her face and covered it with her wig because she was losing hair due to methotrexate for her arthritis, which she ate a lot of sugar, so that probably made it worse. And her skin was she started to, I saw her skin just collapse because she's lost a lot of rapid weight loss. And I saw that with a lot of, my mother-in-law, who just passed away a couple of days ago, same thing. They were vastly different through lack of care, lack of proper nutrition, lack of going out and moving about. And those things can impact your skin and your texture, but also the muscles in your skin, underneath your skin.
Yeah, that's interesting. We probably weren't smiling as much as we normally do during COVID. I mean, it was a really difficult time. We were wearing masks. So, I mean, from a dermatology's perspective, we saw a lot of what we called maskne, which is acne from the occlusion of a mask. But in the grand scheme of things, that people suffered. But yeah, the isolation of COVID certainly affected the elderly. I know it affected school-age children. I mean, how difficult for a 17-year-old to be stuck at home during their senior year.
Yeah.
But in terms of dermatology specific, I don't know that. Well, it's to be seen.
Yeah, probably to be seen. So I'm going to ask you about some specific things, but to the parent who may be watching this, or the grandparent who's taking care of little kids while the parents work, what should they be doing with their children, teaching them and applying to them day in and day out? Because kids are out and about and they're untethered through a lot of the day. What should they be teaching and doing?
I have a 5-year-old. My biggest thing, he knows, it's kind of funny. He avoids the sun and he says, "Oh, it burns." So he's learned that behavior from me, but I think just keep it simple. A sunscreen in the morning, especially if they're going to be doing sports or in the sun doing after school activities, and washing their hands is just a big one at that age. Just hitting home with that and just emphasizing the hand washing, I think, is huge. But all I guess we can get into kind of the tween skincare trends now.
Well, tween is, I had terrible skin. It was devastating. I went through it all, and I tried everything. My grandmother would watch TV, which was before TikTok, and whatever she saw, it would land in my dad to try.
Yeah.
It's a devastating time. How do you handle it with the tweens and having them avoid trying everything?
Do not set them loose in Sephora or Ulta. Like,
Oh yeah.
don't do it. It's just, you're going to spend $400 and it's going to be on things that are garbage. If your child is having trouble with their skin, take them to their dermatologist. Have them see a dermatologist. It can sometimes be very helpful for these young kids to hear something from someone else that's not their parents, and they maybe might tend to listen a little bit more. A lot of the over-the-counter products and a lot of the Sephora products can be really irritating to acne or broken out skin. Some of these kids have eczema on top of acne, so that's a really tricky sort of line to toe, finding a product that's going to clear up their acne but not irritate their eczema. So I think if they're having problems with the skin, get the help of a professional.
And if one isn't saying what you want to hear, keep going. Because I'll be honest with you, Dr. Jacob, I went to several I could write a book. I could call it Shedding My Skin. And one wanted me to shave my face. He swore that Christy Brinkley did it, so I should do it. Atlanta. One created the Buff Puff, Dr. Orentrike. So obviously he was pushing that. I have the most sensitive skin ever. Buff Puff.
I'm surprised for you because I know you're rosacea prone. So those are not necessarily things I would choose for you, but everybody's different, and you really have to sort of customize the skincare to the person. And to have some patients that love to do 8 steps in the morning and 12 steps at night. So I'll work with that, but I don't think it's necessary. So I also enjoy telling people you can cut all these things out and put that away and spend your money somewhere else because it's just not necessary.
Yeah, I spent a fortune, and I mean, I did the Buff Puff. I got someone cryosurgery my face. I had giant blisters. It was traumatizing. It really was. And you don't want to go through that as a teen, and we're in the teen years. Eventually, the reassuring thing, sorta, is you grow out of it. I don't think I ever did because I was still breaking out in my 40s, 50s. Like, because you still get hormone fluctuations, but then you get into pregnancy and potentially fertility drugs if you have to. How does that play around with your skin?
So much. I mean, hormones are a huge part of the health of our skin. And as women, I think we deal with a lot, hormonal fluctuations, and that can totally affect your skin. You might start getting more cystic acne breakouts in your 40s. And it has to do with perimenopause, which is a very real thing. Melasma, which we kind of talked about earlier, there is definitely a hormonal component to that. And when things are changing so rapidly around menopause, perimenopause, it's reflected in your skin. And you might start to get acne. You might notice more brown spots. You might notice a different texture of your skin, but those hormones changes definitely play a role.
And you really have to have a skin plan because it will happen. I mean, my hormones went crazy as a teenager. I had cystic acne. There were scars. There's still scars. I've had to address the scars. And then my skin evened out. And then, now I'm much older. And as you know, because I have rosacea, which appeared. Why does it appear? Is that part of the growing older? Or is it just was always there inside of you, like Glenda the Good Witch says, and one day it just came out? I mean,
no, it wasn't growing inside. It's a combination of things. Rosacea is multifaceted, and it's affected by lots of different things. But we do tend to call it adult acne, so it's very rare to see a young person with rosacea.
I think when I was going through chemotherapy, the first round that I did made my skin incandescent. It was gorgeous, poreless and incandescent, like a nice Korean K-pop king queen. And then we switched to another round, and the rosacea, just little baby pimples popped all over the place. I'm like, it just changed everything. So you have to identify these things. And things change all the time. And when is that a mole or a pimple? Now, so Dave and I have this thing called What's That? He tends to ask me more than I am because he's got baby perfect skin, hairless baby perfect skin, like a big giant beached whale, blah. With me, he'll be like, what's that? So the what's that lately is the dark little cherry spots.
Yeah.
Okay, what are the red spots and why do you get them when you age?
Those are most likely, I mean, I know what you're talking about. I don't want to tell someone if you get a red spot, just assume it's a cherry angioma. But
Right.
the cherry angiomas are what you're referring to. They are so common. I don't think I can find one pretty much on every patient over the age of 40 that I see.
Why?
They're just common. You've acquired them, you've earned them as you get older. We don't know why they happen. They're tiny. If you look at them, if you were to biopsy one and look at it under the microscope, it's tiny little blood vessels that form in an area. Estrogen can sometimes make these proliferate. So this is another thing you can look forward to during pregnancy, is getting more sort of vascular growths on your body. They're benign is the good news, but you can have 20 of them on your abdomen. That's not unusual.
Yeah. And I don't know, can you remove them, or are they just the brownie
You
points of your
can.
life?
Sometimes if they're small enough, sometimes we can burn them off. Sometimes you can bifurcate them. Sometimes you can laser them. You don't have to do any of those things because they're benign, but if they're in an uncomfortable place or they're getting a lot of friction and bleeding on you all the time, I think that would be a reason to get rid of one.
Well, they make one-piece bathing suits great again. The next what's that is the raised peely, what we call the rough patch. The rough patch, it could be red, it could be brown, it could be, but it's one of those what's that's. In fact, one of those what's that sent me to you because he was like, what's that on your back? So what would be other than cancer, why are you getting more rough, scaly brown or red patches here, there, thither, and there? Sometimes they itch, sometimes they don't itch. And why are they there?
So these are, I think you're referring to growths. They're called seborrheic keratoses, and I see them all the time, all day long. They can look really gnarly. I mean, they can look very dark. They're benign, but they can become itchy and irritated and turn pink or even bleed sometimes. We do not know what causes them. They're very common as you get older. Some dermatologists, we've yet to make a connection, but we wonder if there's a virus, like a wart virus, involved in these growths, which would be the HPV virus. Again, that hasn't been proven yet, but you just have to hypothesize that there's something contributing to all of these forming. I will put an asterisk on this. Anytime you have a new itchy bleeding spot or a red spot, don't assume it's benign. Always get it checked out. But most of the time I can happily tell patients that is not a cancer. It's nothing to worry about. And if it's irritated, or even if it's not, we can freeze them off and take care of it pretty easily.
And don't pick at it. Don't scrub it. Don't try to.
Yeah, they pick off. We call them stuck on papules because you can pick them right off. They look like they're just stuck right on there, but they grow back.
But fatty deposits are different. Fatty deposits are like pimples under your skin. What's that?
Okay. I'm assuming you're referring to the lipomas or cysts.
Little like under your skin. They look like pimples, but they're not pimples. They're like fatty raised deposits. I've had them lasered off my face.
Are you thinking of the sebaceous hyperplasia?
Yeah.
The yellow kind of.
I call them fatty deposits, but yeah, sebaceous hyperplasia.
So those guys, those are actually oil glands that are enlarged. So very commonly seen with rosacea.
So basically, I'm doomed. Rosacea sucks, but you have to. Now, the thing so what kept me up at night after I saw you once?
Oh, I know what you're going to say. The mites.
Yeah. So you tell me that there's mites in my bed. So I lie in bed, and at 2 a.m, I start to itch uncontrollably. My head, everything, the pillows. I'm driving David nuts because I want to just buy all new bedding. But you said everybody has mites.
Everybody has mites. Yeah, we all have a microbiome. It's our normal skin flora, and it's important to have healthy bacteria on your skin to keep everything in check. They kind of all work in harmony. The mites that you're talking about are called Demodex, and when they proliferate a little bit too much, then they can cause rosacea and cause acne, and you treat that a little bit different than you would a normal acne. So I think we use probably a topical ivermectin to treat that aspect of the rosacea.
We did Doxy too, but the whole skin and the flushing and Doxy also plays with your microbiome, makes you feel a little icky.
Yes.
And you can't be on it forever. But it does. So here's the question. Do you need to change your bedding and your pillows? I mean, do they live in your pillows?
I think once a week is probably a good idea to change your sheets and pillowcases. I don't want you to think they need us to sort of support them and keep them alive. So they're not going to live as fomites on an idle surface. So I hate telling people about the mites because it does tend to freak you out, but it's just a part of our normal flora.
Well, don't Google it, anybody, because I did. And then, once you Google it, then you get all the weird, creepy ads for people to say, and I got all the weird, creepy, don't Google anything anymore. It's just not worth it. Don't Google any illness. It's just not worth it.
I agree.
As you said, Dr. Jacob said, this is just normal. Don't freak out. I had a couple of nights where my brain started working it, but I've worked through that.
I disclose that to you because I want you to understand why I'm giving you the medicines I'm giving you and why they're will or won't work for you. So
and you're normal. I mean, a lot of people have rosacea. A lot of people have adult acne. You're not alone. The thing is, you're not alone. But don't suffer in silence. Go see someone who's a professional.
Yes.
And don't listen to TikTok. Which brings me to what my very last question is. One of them. What's with the glassy skin? And the snail mucin, the mucin.
Yeah. Wouldn't we all love to have skin that looked like the surface of glass? I mean,
why?
I think it's an idealized sort of thing. It's a when we put filters on our skin, we're blurring our pores so that we look more even. It's just a sort of beauty perception. No one has, I don't want to say no one, but it's very uncommon to have perfectly glassy skin, right? I mean,
I don't know. You do. Everybody, she has the most gorgeous skin ever because you're a dermatologist. You have gorgeous skin.
Well, thank you. But even I get pimples. I have one right there.
Okay.
So it happens. But the glassy skin, I think, is just an idealized idea of we want perfect, blemish-free, spot-free skin.
I'm just worried, and then somebody was trying to sell me on the snail mucin, snail.
Yeah. Snail mucin is a thing.
It's an expensive thing.
It's an expensive thing. And I don't know that it's going to be better for you than if you were to use Aquaphor on your face once a week. I don't think, Melanie, that you should use Aquaphor because I don't think that's right for your skin type. But for some people that have drier skin or they get dry patches, the slugging, which is the TikTok trend where you cover your face in Vaseline or Aquaphor and sleep with that on.
Slugging.
That can be appropriate and effective for people that have issues with hydration. But if someone has issues with acne or rosacea, that may not be the most appropriate thing for them to do.
Again, don't just because somebody else is doing it. A friend gave me something yesterday to try.
Okay.
It's a major name. She's advertised, very well known. I put it on. I just looked redder.
You didn't like it?
Okay. Well, no, it's probably great for somebody, but it's not my skin, not my skin type. And I feel this way about skincare as I do what you put in your body, on your body, how you care for it, and also your makeup. It's got to be individualized for you.
Totally. Absolutely.
It cannot be what your friend just gave you to try. I was like, oh my God, I'm like redder than ever. I'm gonna give it back to her. But and you really should not be trying your friend's products because there's germs in that.
Oh, sure. Yes. I didn't think about that, but yes.
Yeah, the worst pink eye of my life was when I went to Sephora and had them do my
I believe
face
you.
for my book tour. So I did
Oh
my book
no.
party with pink eye because I went to Sephora. You know, spend the money and have somebody come to your house, have it done. Don't go somewhere where everybody's using different stuff. Don't
Yeah, use
share.
your own applicators. Yeah, I think that's
Yeah.
important.
Yeah. Do you ever, I mean, because a lot of people, probably including me, never wash their brushes or anything. So,
I don't watch them as much as I should.
yeah. So, last question. You're on a budget. God, everything's expensive. Everything's expensive. You're on a budget.
Hmm.
What, you don't have to name brand, but what can you find?
Okay.
Is it a dime store opportunity, a Marshall's opportunity, or you got to spring for something a little better?
Um, you can find some stuff at Marshall's. Dime store, probably not. But definitely Walgreens, CVS. I buy a lot of my skincare products at
Mm-hmm.
CVS.
Mm-hmm.
I can say some brands that I support. Cream is one that I love.
Mm-hmm.
It's not fancy, but I think the ingredients are really clean, and I feel comfortable telling people with really sensitive skin that they can use that.
Mm-hmm.
Neutrogena makes some great sunscreens. Blue Lizard makes a great mineral sunscreen that I use on
Mm-hmm.
my son. So I think the drugstore is a great place to find good skincare products that
Mm-hmm.
work.
Cream. I followed the New York Times wire cutter,
Uh-huh.
and they gave that one high remarks, not for the packaging, but who cares?
It's not fancy. Yeah, it's
Yeah,
not fancy.
the content, and then were this one called Super Goop, which I think you have in your thing, but the Super Goop had some issues recently.
Yeah.
Yeah, so I don't know. We won't go there, but it was supposed to be good, but maybe not so good now. I use, I'll say I use Elta.
They
It costs a lot more money, but I swear by it.
I do too. I mean,
Yeah.
we sell it in our office, but that's personally my sunscreen of choice is the Elta MD one. I'm not to
Mm-hmm.
say there's not a good one that you can get at CVS and Walgreens, but for me and for my skin type, the Elta feels the best for me, and it's like a little luxury that I put on in the morning.
Well, I'll do sometimes when I'm just hanging out during the day in front of the computer, I'll do like my Neutrogena.
Uh-huh.
And I use a lot of CeraVe, my drugstore, and then my Elta is my go out one.
Yeah, so you can make your
Yeah,
product last longer.
just like me and the shampoo, the Olaplex is for now occasionally, and then I bought something at Costco that's Pantene in a giant tub, and my
Yeah.
hair still looks great. So,
Yeah.
so the thing is, you don't have to spend a lot on what you put on your face, but it is essential. How often should you get your skin checked?
It depends on the person. I would say once a year for anyone. It depends. If you're somebody that has a lot of moles, definitely at least once a year. If you're somebody
Yeah.
that has a history of skin cancer, probably at least once a year, maybe every 6 months.
Mm-hmm.
It kind of depends on your risk factors and what you're sort of dealing with, but it's
your
never a bad
insurance.
idea. And your insurance, because that's right.
Yeah.
Sometimes it's not covered.
Yeah.
But it's not a bad idea to go in and just get a baseline look over from head to toe. And then your dermatologist can tell you how often you should be seen based on what they find at that visit.
Yeah. And when you get a skin check, you are going to go head to toe. Don't be shy. Bear it all.
Right.
Let it appear everywhere, because it can be in your scalp. It could be behind your ear. Bob Marley. It could be in your toenail.
Yeah. Under the feet. I always look under your feet, in between the toes.
Yeah.
So yeah, we don't care. We want to see it all.
Well, I want to thank you for taking time to be with me. We've been talking with Dr. Leah Jacob, and you practice here, but a Family Dermatology Specialist. Do you have a website, or is it the Family?
We do.
Dermatology? Yeah.
I believe it's familyderms.com.
Mm-hmm. I love them. I'm really glad I found you. Get a dermatologist. Always should be as important as your gynecologist, your primary care physician, and your dentist.
Agree.
All right. Well, thank you again. I really appreciate your time.
It's fun.
I hope it's been helpful for all of you. I kind of bear it all and share it all because I want you, my listeners and viewers and fans, to be confident about taking better care of yourself all the time, because you want to live the best of your life the rest of your life. I'm Melanie Young. This is Fearless, Fabulous You. You have the choice to live life on your terms, always choose Fearless and Fabulous. And follow me on Melanie Fabulous. Thank you.